Assalamualaikum beta. In this video lecture, I will deliver the lecture on urticaria, also known as hives by the way. It is beta acute inflammatory condition of the skin. Okay, I can say it is acute inflammatory dermatosis. Okay, so I have brought this topic in very easy and kind of explanation that is very much enough, and this lecture is completely from your textbook Robbins spaces. Okay, so I have summarized the explanation into this thing like this. Okay, it starts from here beta. It starts from here that any antigen that I will surely talk about, it can follow one of these three routes. Any antigen in the environment can follow any one of these three routes. Okay, by the way, what is this particular area where these three routes are occurring? This is dermis. This entire is dermis, above which is epidermis. So urticaria occurs in dermis and it has nothing to do with epidermis. Okay, so antigen is there and it can follow one of three routes, and as a result of those, what happens, beta, let me tell you. One of three routes beta. Yeah, number one, that the antigen, okay, it may be any antigen like pollen, any food, any drug, insects, or some kind of venoms. Whatever this antigen is, it is binding to IgE antibody, which is ultimately bound with this Fc receptor on the surface of mast cell. Okay, when this antibody carrying antigen binds with mast cell, this mast cell degranulates and it releases some mediators. Okay, it releases some mediators. And okay, what do these mediators do? We'll talk about that later. So first of all, antigen comes, binds with IgE antibody, and then IgE antibody later binds with mast cell, and it releases mediators and it does something with your blood vessel. So what should be the name for this number one thing? This should be called as IgE dependent plus mast cell dependent pathway. Okay, if I'm not wrong. Yeah, you do follow it. Okay, you liking it? You are like looking it like this is IgE. Okay, so it is involving IgE antibody and IgE antibody and mast cell as well. Okay, so it should be called as IgE dependent and mast cell dependent pathway. Okay, let's see number two. Antigen may be any opiates, this kind of drugs, certain antibiotics, carrier, radio contrast media, any antigen specific to this pathway. It is now not really binding with IgE antibody. IgE antibody is missing here, and this antigen is directly triggering the mast cells to degranulate, and once they are degranulated, they release mediators. And these mediators again do the same way, they act on the blood vessel. What should this pathway be called as? Is it IgE dependent? No, it should be called as IgE independent pathway plus mast cell dependent. Okay, this was IgE dependent plus mast cell dependent pathway. It is IgE independent and mast cell dependent pathway. I will tell you what these mediators are going to do with your blood vessels and what's going to happen in urticaria, but let's first get done with this. Here at number 3, what is this going on? Some chemicals or drugs acting as antigen, they have nothing to do with IgE antibody, and there are no mast cells, by the way. So it should be called as, they are like directly acting on the blood vessels, and producing the effects the same way these mediators were producing. Okay, so this pathway should be called as IgE independent plus mast cell independent pathway. No involvement of mast cell, no involvement of IgE antibody. Okay, all these are having some effects on blood vessels in the dermis. This is your dermis, and having some effects on this blood vessel in the dermis. So what are the effects? Dermal microvascular hyperpermeability. This is the microvessel. Its permeability will be increased. When its permeability is increased, what will happen? Inflammatory exudate, plasma fluid will be coming out of this blood vessel, and in entire dermis there will be edema. Okay, fluid accumulation, dermal edema हो जाएगी. और उसके अलावा क्या होगा, इस blood vessels में से जो cells होंगे inflammatory इन्फिल्ट्रेट वो बाहर आ जाएंगे. ठीक है, खास करके मोनोन्यूक्लियर सेल्स, रेयरली न्यूट्रोफिल्स एंड इजिनोफिल्स. ओके, सो न्यूट्रोफिल्स, eosinophils and mononuclear cells. Okay, so when the permeability of this blood vessel is increased, so there will be dermal edema, especially in the edema of the deeper dermis and the tissue beneath this dermis, that is subcutaneous tissue. So this edema of the deeper dermis and the subcutaneous tissue is called angioedema. Okay, this is what happening. And now you know beta edema has occurred. Now what are the consequences of edema? Edema की वजह से क्या होगा? Collagen bundles are more widely spaced in the dermis than in the normal skin due to superficial dermal edema. जो इस dermis में collagen bundles मौजूद थे normally, अब चूंकि बेटा edematous fluid आ गया है तो उसकी वजह से जो collagen bundles थे वो बहुत ज़्यादा spaced हो जाएंगे, वाइडली स्पेस हो जाएंगे, अपनी नॉर्मल जगह पे नहीं रहेंगे. जाहिर सी बात है, जब इसमें हम एक्स्ट्रा चीज़ हमने इन्फ्लेमेटरी एक्सुडेट इसमें ऐड कर दिया है तो वो जाहिर है वो प्रेशर डेवलप करेगा और जो कोलेजन बंडल्स हैं वो स्पेस्ड हो जाएंगे, दूर हो जाएंगे अपनी जगह से. ठीक है, और जाहिर सी बात है बेटा, जो यहाँ से लिम्फेटिक ड्रेनेज बाहर जा रही थी वो लिम्फेटिक चैनल्स भी बहुत ज़्यादा डायलेट हो जाएंगे, क्योंकि वही फिर जाहिर सी बात है यहाँ पे एडिमा जमा हो गया है तो उन एडिमा को ड्रेन करने का काम यहाँ से लिम्फेटिक्स का हो सकता है. ठीक है, तो ये लिम्फेटिक वेजल्स ज़्यादा से ज़्यादा एडिमा को यहाँ से ड्रेन करने की कोशिश करेंगी तो ये डायलेट हो जाएंगे. ठीक है, सो द सुपरफिशियल लिम्फेटिक चैनल्स विल बी डायलेटेड. राइट, ओके. What will happen to your skin beta if there is dermal edema like this we have just discussed? There will be formation of, there will be very much pruritus, that is very much itching, because you know the products of the mast cell, they do produce, you know, itching. So there will be pruritic lesion on the skin, that is pruritic papules will appear. Pruritic papules to large edematous plaques जो कि मिल जाते हैं और फिर एक बड़ा सा व्हील बनाते हैं. व्हील बोलें जिसका एनुलर शेप भी हो सकता है, लीनियर कन्फिगुरेशन भी हो सकती है, आरसी फॉर्म कन्फिगुरेशन भी हो सकती है. मैं बताता हूँ बेटा मैं क्या कहना चाह रहा हूँ, लेकिन आप ये समझें कि ये जो डर्मिस के अंदर कंडीशंस प्रोड्यूस हुई हैं, डर्मल एडिमा and you know everything, whatever I just told you, what will appear on your skin, what you will see here on your skin, you will see there are very much pruritic papules, या फिर papules से बड़े plaques हो सकते हैं आपकी स्किन पे जो आपस में फ्यूज़ हो जाएंगे और व्हील बनाएंगे. अब वो एनुलर भी हो सकता है, लीनियर भी हो सकता है, आरसी फॉर्म भी हो सकता है. लेट मी शो यू लाइक दिस. कैन यू सी दिस इज़ अ plaque if I'm not wrong. This is edematous plaque. This small maybe a plaque or papule, but you know they have coalesced with each other. They have coalesced with each other. Okay, this entire is your wheel. This entire is your wheel. It may be having annular shape, that is circular, or it may be having linear or RC form configuration. This is the RC form configuration. Okay, this is the RC form configuration of the wheel. Right, this is all about beta, almost all about the urticaria. But few things I have written at the top, that it appears mostly in the age of 20 to 40 years, and the lesion of this urticaria develops and fades within less than 20 hours. Like if I developed the wheel here, it will be faded in 24 hours or even less. Okay, बट उसका दोबारा एपिसोड आता है, फिर वो फेड हो जाता है, फिर एपिसोड आता है, फिर फेड हो जाता है. ये तकरीबन एपिसोड्स जो है कुछ दिन या कुछ महीनों के लिए चलते हैं. ठीक है बेटा, कौन सी साइट्स पे ये अपीयर होता है? मोस्टली द साइट्स विच आर areas which are exposed to pressure, like trunk, distal extremities and ears. Okay, yeah, and there are no changes in the epidermis, you will see. Okay, that's all about beta this lecture urticaria. Okay, if you have any question you can ask me anytime, anywhere. Okay, if you really got some concepts, you can appreciate me by liking to the video and subscribing to the channel. Thank you so much beta. Class dismissed.